Okay, so picture this. You need medical care, but you don't have to worry about the bills at all. You're covered because healthcare is like a right, not a privilege. That's the ambitious idea behind Kenya's new social health insurance fund, or SHI.
It really is fascinating to see this kind of shift taking place, trying to make healthcare truly universal, like in some European countries, raises a lot of questions about, how to make it work practically.
Totally. And that's exactly why we're doing this deep dive. We're going way beyond just the headlines and really trying to unpack how this transition from the old NHI system to CRIF is going to work. We've got legal documents, expert analysis, even a plain language explainer to help us along. What's the most important thing you should know? How will this affect you directly? That's what we're here to find out.
We're starting with the very foundation. The Kenyan Constitution actually guarantees the right to health care right in the Bill of Rights, so that kind of sets the stage for a SHIF.
So it's not just a good idea. It's like built into the core values of the country.
Right, and a SHIF is meant to turn that right into reality. The goal is universal health coverage, or UHC.
All right, break that down for me. What is UHC and why should we care?
Okay, imagine never having to choose between putting food on the table or getting the medical treatment that you or your family needs. That's the essence of UHC. Everyone, rich or poor, has access to the healthcare they need without going broke.
Got it. So SHIF is like the vehicle, UHC is the destination. How are
Yeah.
we actually getting
Oh, this is a major overhaul. SHIF is replacing the old National Health Insurance Fund, NHIF, which has been around for almost 60 years. The official switchover starts October 1st, 2024.
Wow, I bet there are a ton of people out there scrambling to figure out what this means for them. What's the biggest difference they'll see like right away?
One of the most striking changes is that with SHIF, you can get primary care and emergency treatment just by being registered, even if you haven't paid your contributions yet.
Wait, seriously, that's a huge change from NHIF. You had to be totally up to date on payments to get most services.
It is, and it highlights that fundamental shift in the thinking behind SHIF. It's about prioritizing access to essential care immediately. Imagine someone delaying treatment for a serious infection because they're a few weeks behind on payments. That's the kind of scenario SHIF is designed to prevent.
That makes a lot of sense. So it's less about punishing people for maybe falling behind and more about just ensuring everyone gets the basic care that they need.
Exactly. Now let's dive a little deeper into the structure of SHIF. It's not just one big pot of money. It's split into 3 different funds. You've got the primary healthcare fund, the social health insurance fund. Yeah, a little confusing, I know. And then the emergency chronic and critical illness fund.
Okay, 3 funds each with a different purpose, I guess. So what's the logic behind that?
Then it's about making the system more targeted and more efficient. So the primary healthcare fund focuses on the basics, routine checkups, vaccinations, managing common illnesses. This strengthens the foundation of the healthcare system. Then there's the social health insurance fund, SHA, which covers a broader range of services, outpatient care managing chronic conditions, and maternal care.
So it's like building blocks, each layer
Yeah.
kind of supporting the one above it.
Exactly. And for the most serious situations, you've got the Emergency Chronic and Critical Illness Fund. This one kicks in when things get really tough. It covers emergency treatment and also steps in to manage the cost of chronic illnesses when you've kind of exhausted the benefits from the regular SHIF fund. It's a safety net for when you need it most.
Okay, that's starting to make a clearer picture for me. We've got the why behind SHIF, the structure, but who is paying for all of this?
Well, that's where it gets interesting. Contributions are mandatory for all adults who want to access government services. Not just healthcare, but things like getting a passport, a driver's license. It's not really optional. It's tied into a whole range of services.
Wow, so it's really woven into how things work in Kenya. What about people who can't afford to contribute?
That's where the government steps in. They'll be covering the costs for individuals considered indigent and vulnerable, ensuring everyone has access regardless of their situation.
Okay, so we've established that everyone contributes.
Yeah.
But how much are we talking about? Is it a flat rate or what?
Not exactly. For employed individuals, the contribution rate is 2.75% of your gross monthly income. And here's a key difference from that old NHIF system. There's no cap on how much you can contribute.
So if you're earning more, you contribute more, which makes sense in terms of fairness. But why get rid of the cap entirely? What was the thinking there?
Well, remember, the goal is universal health coverage. Removing that cap ensures that SHIF has a more stable funding base. It also means those with higher incomes contribute a larger share, which helps to subsidize care for those who can't afford it.
It's kind of like a progressive tax system, but for healthcare.
You could think of it that way. It's a way of pooling resources and distributing them more equitably.
That's a really interesting approach. Okay, so we've talked about who pays the structure. Now let's get to what does IF actually cover?
One of the most significant improvements over NHIF is the expanded coverage for chronic illnesses. Think about conditions like diabetes, hypertension, heart disease. These require ongoing management and can be incredibly expensive.
I can only imagine how stressful it would be to deal with a chronic illness and constantly worry about medical bills on top of everything else. How does IF make a difference there?
ISH covers a wider range of chronic conditions and provides more financial support for things like medication therapy, specialized care.
Can you give me a specific example?
Sure, take kidney disease, for instance. SHIF covers more dialysis sessions per week and even helps with the cost of erythropoietin injections, which are essential for patients with kidney failure. That kind of support can be life-changing.
That's incredible. It sounds like they're really trying to take the burden off people dealing with these serious conditions.
They are, and it's not just about covering more conditions, it's also about improving the quality of care. SHIF introduces standardized treatment protocols for chronic illnesses, so you'll receive consistent care no matter where you go for treatment.
So it's about creating a more unified and reliable system, which makes sense. You don't want your quality of care depending on which doctor you happen to see that day.
Exactly. And another area where SHIF really steps up is maternal health care. Sadly, maternal mortality rates in Kenya are still way too high. SHIF aims to change that.
It's heartbreaking to think about mothers losing their lives because of complications that could have been prevented. How will SHIF make a difference?
It starts with expanding coverage for prenatal care delivery and postnatal services. And here's a really crucial detail. All pregnant women are automatically enrolled in SHIF. This makes sure they have access to comprehensive care throughout their pregnancy and childbirth.
No extra paperwork or hoops to jump through.
Nope. The goal is to remove any barriers to accessing essential care during such a critical time.
That's fantastic. So they're focusing on prevention, expanding benefits, streamlining access. It sounds pretty promising.
Yeah.
But are there any potential downsides or challenges with SHIF?
Of course, no system is perfect. One of the biggest challenges will be ensuring financial sustainability. Universal health care is expensive, and the government needs to make sure there's enough money to cover the costs, especially with the removal of that contribution cap.
Right. If more people are accessing more services, someone has to foot the bill. Could the fund become overwhelmed?
It's definitely a risk. The Social Health Authority will need to manage those funds very carefully and really monitor the system to make sure it's sustainable in the long run.
So smart planning and responsible management are going to be key. What other challenges do you see?
Another major hurdle is making sure everyone has equal access to healthcare services. Even if technically everyone is covered, other factors can prevent people from getting the care they need.
Like what kinds of things?
Think about geographical barriers. People in more remote areas might not have easy access to hospitals or clinics. And then there are social and cultural barriers to consider too. Things like stigma surrounding certain health conditions or discriminatory practices within the healthcare system itself.
Those are serious issues.
Yeah.
So SHIF can't just be about providing financial coverage. It also needs to address these systemic problems that are preventing people from actually accessing care.
Exactly. And then there's the logistical challenge of the transition itself. Moving millions of people from one system to another is a massive undertaking. It has to be done really carefully to avoid confusion, delays, disruptions in care.
That sounds like a recipe for chaos if it's not handled right.
You're telling me. Clear communication training, healthcare providers, and a robust IT system will be crucial to make that transition smooth.
With all this digital information going around, what about data privacy? That seems like it could be a major concern.
You're right, data security is paramount. The Social Health Authority needs to implement strong measures to protect sensitive health information and build trust in the system. They need to be transparent about how they're using that data and make sure people have control over their own information.
So it's a balance between using technology to make things more efficient and making sure people's privacy is protected.
Absolutely. And finally, there's the ongoing challenge of accountability and transparency. JFIN needs to be managed with integrity to prevent fraud and make sure those funds are being used responsibly.
Especially given the history of corruption in Kenya. People need to know their money is being used for its intended purpose.
Exactly. They need to see that the system is working for them, not against them.
Yeah.
That builds trust, and it makes people more likely to buy into the system and support it in the long run.
Okay, so we've laid out the potential benefits and some of the challenges. Let's bring it back to the listener. What should you be doing to prepare for SHIF and make sure you're getting the most out of it?
First and foremost, make sure you're registered with the Social Health Authority. Remember, registration is mandatory for all adults seeking any government services, not just healthcare.
So this isn't just about going to the doctor. It's tied to a whole bunch of things.
Right. Without registration, you could run into problems accessing things like passports, driver's licenses, or even educational opportunities. So get registered and make sure your info is up to date.
Okay, registration check.
What else? Once you're registered, take some time to understand the benefits package. What's covered? What are your cost-sharing responsibilities? What are your rights as a beneficiary? The more you know about how SHIF works, the better you can advocate for yourself and your family.
Knowledge is power, especially when it comes to something as important as your healthcare.
And don't be afraid to ask questions. If something is unclear, reach out to the social health authority or an organization that can help you navigate the system.
This is a big change for everyone, so it's okay to admit you need some guidance.
Exactly. It's a learning process for all of us.
Okay, so we've talked about the mechanics of SHIF, the benefits, the challenges, what you can do to prepare. Now let's zoom out a little bit. Can SHIF really achieve universal healthcare coverage in Kenya? It's a bold goal, and we've explored both the potential and the hurdles.
It's a question that only time will fully answer. SHIF is a step in the right direction, but it's not a magic solution. It will require sustained commitment from the government, effective implementation, and ongoing adaptation to address those challenges as they pop up.
It's about more than just passing a law. It's about creating a culture of healthcare as a right, not a privilege.
Exactly. And it's a collective effort. It involves the government healthcare providers, employers, and most importantly, citizens like you.
So as we wrap up this part of our deep dive, what's the key takeaway for our listeners?
SHIF has the potential to transform healthcare in Kenya and improve the lives of millions of people. But it's not a guarantee. The path to UHC is complex, and it demands active participation from everyone.
So it's about staying informed and engaging in the conversation.
Yeah.
And holding those in power accountable. It's our health, after all.
Couldn't have said it better myself. Now, before we wrap things up, I did want to highlight a few surprising details I found digging through all these documents, things you might not expect from a social health insurance program.
Okay, I love those unexpected twists. Give me the good stuff. What stood out?
Well, first, did you know that SHIF covers treatment overseas? If a specific treatment isn't available in Kenya, you can actually apply to have some of the costs covered for treatment abroad.
Wow, really?
Yeah.
I had no idea. That seems like a pretty big deal, especially for people with maybe rare conditions or those who need highly specialized care.
It is. It really shows their commitment to comprehensive coverage. And it ties back to that idea of UHC we talked about earlier, ensuring everyone has access to the care they need regardless of where it is.
I wonder how many people will actually be able to use that. It sounds like it could open up a lot of possibilities.
I'm sure there will be challenges, but the fact that it's even an option is significant. It's like a global approach to healthcare.
Okay, what else surprised you?
Another thing that stood out to me was the focus on preventative care. SHIF isn't just about treating people when they get sick, it's about trying to keep them healthy in the first place.
Yeah, that makes sense. Prevention is always better than a cure, right? But what does that look like in practice?
Well, for one, SHIF covers a wide range of health screenings. Things like cancer screenings, diabetes tests, checking for high blood pressure. Catching these things early can make a huge difference in terms of treatment success.
It's so much better to catch things early rather than wait until they become serious problems. I know I'm definitely guilty of putting off those checkups sometimes.
We all are.
Yeah.
But with SHIF covering the costs, there's one less barrier. It also covers vaccinations for both children and adults to help prevent the spread of infectious diseases.
So it's a holistic approach looking at the whole picture of health and well-being.
Exactly. And from a financial perspective, it just makes sense. Investing in prevention can actually save money in the long run because it reduces the number of people who develop expensive chronic illnesses.
Okay, one last thing before we let our listeners go. We've talked a lot about the nuts and bolts of SHIF. But what role does technology play in all of this? It seems like everything is going digital these days.
You're right. Technology is a key part of the vision for SHIF. They're developing an e-claims management system, so submitting and processing claims should be much faster and more efficient. No more mountains of paperwork.
That's good news for everyone. I can't imagine dealing with all that paperwork as a doctor or a patient. Plus, it probably reduces the risk of errors, too.
Absolutely. And we talked about the SHA employer portal earlier. That lets employers manage everything online, from registering employees to tracking contributions. It's all about simplifying the administrative side of things.
And we can't forget about the potential for technology to really improve access to healthcare in those remote areas. Imagine someone in a rural village being able to consult with a specialist in Nairobi through a video call.
That's the power of telemedicine. It's already happening in some places, and with SHIF investing in technology, we could see it becoming much more widespread. Of course, there are challenges like making sure everyone has reliable internet access and protecting patient privacy, but the possibilities are really exciting.
It feels like we're at the beginning of a major shift in healthcare, both in Kenya and globally. This deep dive into SHIF has been fascinating. We've covered a lot of ground from its roots in the Constitution to the details of coverage and the role of technology.
It's been quite a journey, and it's a good reminder that we're all part of this. The success of SHIF depends on all of us staying informed, asking questions, holding those in power accountable.
So as we wrap up, what's the one thing you want our listeners to take away from all of this?
I think SHIF represents a huge opportunity to create a more equitable and accessible healthcare system in Kenya, but it's going to take all of us working together to make that vision a reality.
Stay engaged, stay informed, and remember, your health matters. That's it for this deep dive into Kenya's new social health insurance fund. Until next time, keep learning, keep exploring, and keep asking those tough questions.